CEN Online Course YouTube. Question 1. A patient presents with fever, chills, and a productive cough with rust-colored sputum. The nurse recognizes this as consistent with viral pneumonia, mycoplasma pneumonia, pneumococcal pneumonia, tuberculosis. Question 2. A patient develops a sudden, severe headache described as the worst headache of my life, along with nuchal rigidity and photophobia. The nurse suspects migraine headache, tension headache, subarachnoid hemorrhage, meningitis. Question 3. A patient with COPD and a history of carbon dioxide retention is receiving oxygen via nasal cannula at 4 liters per minute. The nurse notices the patient is becoming lethargic. The appropriate action is to increase the oxygen to 6 liters per minute, decrease the oxygen to 2 liters per minute, prepare for intubation. Administer naloxone. Question 4. A patient with known borderline personality disorder presents with superficial wrist lacerations. The nurse's priority is providing emotional support, suturing the wounds, assessing for suicide intent, discharging the patient home. Question 5. A patient presents with altered mental status, meiosis, bradycardia, and copious secretions. The nurse suspects organophosphate poisoning. The treatment is naloxone, flumazenol, atropine and pralidoxime, activated charcoal. Question 6. An adult patient with acute asthma exacerbation is not improving after 3 rounds of nebulized albuterol and ipratropium. The nurse anticipates oral corticosteroids, intravenous magnesium sulfate, discharge home, chest physiotherapy. Question 7. A patient presents with acute onset of tearing chest pain radiating to the back, along with a blood pressure difference of 30 millimeters of mercury between arms. The nurse suspects acute myocardial infarction, aortic dissection, pulmonary embolism, pericarditis. Question 8. A patient with a history of depression arrives after ingesting an unknown quantity of acetaminophen. The nurse anticipates activated charcoal, N-acetylcysteine, sodium bicarbonate, flumazenol. Question 9. A family member of a patient in cardiac arrest insists that everything be done to save the patient, despite the patient's living while declining aggressive measures. The nurse should follow the family's wishes, continue CPR until the physician clarifies the advance directive, stop CPR immediately and contact risk management. Ask the patient what they want. Question 10. A patient presents with confusion, nausea, and a fruity breath odor. The nurse suspects diabetic ketoacidosis. The priority is to administer insulin, establish 4-access and begin fluid resuscitation, obtain a serum glucose, administer sodium bicarbonate. Question 11. A patient presents with hematemesis and melena. The nurse's priority is insert a nasogastric tube, administer oral vitamin K, establish 2 large-bore 4 lines and administer fluids. Prepare the patient for an endoscopy. Question 12. A patient presents with severe hypertension, headache, and altered mental status. The nurse recognizes this as hypertensive urgency, hypertensive emergency, hypertensive encephalopathy, benign essential hypertension, subarachnoid hemorrhage. Question 13. A patient presents with a fever, headache, and neck stiffness following a recent tick bite. The nurse suspects Lyme disease, Rocky Mountain spotted fever, ehrlichiosis, anaplasmosis. Question 14. A patient is placed in 4-point restraints for violent behavior. The nurse's ongoing responsibility includes documenting the behavior requiring restraint, ensuring a physician's order is obtained, providing regular monitoring and release of restraints. All of the above. Question 15. A patient presents with sudden onset of severe, diffuse abdominal pain, vomiting, and a history of alcohol use disorder. The nurse anticipates an order for NG tube placement, serum amylase and lipase, abdominal CT, all of the above. Question 16. The nurse is assessing a patient with a suspected pulmonary embolism. Which finding is most consistent with this diagnosis? Productive cough with green sputum, absent breath sounds on one side, sudden onset pleuritic chest pain and tachycardia, fever and chills. Question 17. A patient presents after a house fire with dyspnea, sooty sputum, and a brassy cough. The priority nursing diagnosis is fluid volume deficit, impaired gas exchange, ineffective airway clearance, pain. Question 18. A patient with chest trauma is noted to have paradoxical chest wall movement and shortness of breath. The nurse suspects tension pneumothorax, simple pneumothorax, flail chest, cardiac tamponade. Question 19. A state senator is being treated in the ED, and a staff member discusses his care with a local reporter. The facility is most likely to face a lawsuit for false imprisonment, defamation, libel, invasion of privacy. Question 20. Which laboratory value is most specific for acute myocardial infarction? CEN, myoglobin, troponin I, BNP,